Hello, Gary Crowley here with DoItYourselfJointPainRelief.com. We're on step 3 of finger joint pain relief. And basically what we're going to do in step 3 is make sure that all these muscles in your forearm are loose and free and open so that they are not negatively affecting those fingers. If you press into your forearm and you move your fingers, you'll feel that these muscles in your forearm are doing a lot of those motions. So they're big players, and if they get tight, they can yank on basically things and make you feel it in your fingers. So first thing we want to do is take your forearm, if these are the fingers or this is the finger that's bothering you, and either on your lap or on a pillow or something of some sort. First, you want to take your opposite thumb and dig into that forearm and just make sure. Just kind of investigate around, and if you find you're not pressing really hard, but you want to investigate. If you find a tender spot there, we just want to open and close that forearm, even if it's not the particular finger that's bothering you. We just want to make sure everything in this forearm is nice and open. So, because the more freedom you have, the better everything works. So, we're not gonna hurt your other thumb doing this, but you want to investigate around. And I do press, hold, move a lot with these muscles. You can do press, pull, release. That'll get some of the work done, but your brain really seems to like the press, hold, move because you have a lot of nerves running through here. So you do that for a little while, and about the time your thumb starts getting a little tired, you probably want to do the other way into your forearm, where you take your opposite forearm. It's not the point of your elbow, but it's this last inch, 2 inches of your forearm, and you want to press it into your forearm. And if there's a tender spot in there, especially one that was a little stubborn with your thumb, just want to open and close, and then you can do some of that. You can make some circles, but basically opening and closing is probably the best way. And mostly, you're probably going to be in this upper 2/3 of your forearm. There's one muscle here, but that mostly goes to your thumb. We'll do that in the thumb section. And so the bellies of these muscles are all up here, and then they become a little more tendinous down here. So you do that on any tender areas until it releases. Then you flip your arm over. You take your fingertips, and you do the same thing on what we consider the top of your forearm. You want to feel around for any tender tissue, and when you find it, you're basically pulling your fingers back toward the top of your forearm and release that. Now there's one pretty nervy area there. You can dig on that. It's always going to be a little tender. If it's crazy muscularly tight, you can press, pull, release, and press, hold, move on a little bit, but don't ever expect that it's going to be completely non-tender, because again, there's a lot of nerves in there. And after you do that, again, probably about the time your fingertips are getting tired, if there's any real stubborn tender spots, now we want to take the point of our elbow and gently, very gently, stick it in the top of that elbow on any tender spots and make that tissue. I would definitely do press, hold, move on this, because you want to make sure that you're making that tissue move under the point of your elbow. And that's this side. Thumb, forearm, not point of your elbow. This side, fingertips. Always aware that it's always going to be a little tender there, because there's kind of a big nerve plexus there. And then gently but firmly the point of your elbow on any real tender spots to help that release. And then notice how that helps your fingers feel. And then now that you're through step 3, you want to do an assessment of everything you've done. You want to notice what steps worked the best at relieving your finger pain. You want to notice what techniques within each step seem to give you the biggest relief, in case you need to do them again in the future. And you also want to think back and notice what spots were still tender and could use a little more work, because sometimes now that you've gone around and through everything once, you go back to, say, a really tight tricep or a really tight muscle in the palm of your hand that was really tight before, and now you can get in there and you work it a little bit and it lets go, and then your finger pain is completely gone. And again, lastly, if you're on these knuckles, take your time because it can be painful, but if it's just your knuckle that's hurting, you can work that free. And it's painful, but it's worth it because pretty quickly you can get that knuckle released and you'll be out of pain. But it is painful, so take your time. Thank you for your time, and I look forward to hearing how it goes. Thank you.